Good day, everyone. So, I'll be discussing the role of physical therapists in sports. Physical therapy in sports, a brief definition, is a specialized field focusing on enhancing the athletic performance, preventing injuries, and aiding recovery for athletes at all levels. Physical therapists also develop personalized treatment plans that address pain relief, improve range of motion, and strengthen muscles to optimize sports performance and facilitate a swift return to activity. So, to further discuss this, PTs are crucial for athletics, ranging from weekend warriors to professionals, because they provide tailored care that meets the unique demand of each individual sport and body. For amateurs, physical therapy helps prevent injuries and manage minor aches to maintain consistent activity, while for elite athletes, it supports peak performance and fast recovery for intense training or injuries. Moving on to the injury prevention, one of the most common or the most important roles of physical therapists is injury prevention. So they carefully assess the entire anatomy of the patient or how an athlete moves, their muscle strength, and flexibility. This helps them identify any weaknesses or imbalances that could lead to an injury. So, based on this, they usually design personalized exercise programs to strengthen muscles, improve flexibility, and stabilize joints. And this proactive approach helps athletes avoid injuries and stay in the game longer. Next, rehabilitation after injury. So, despite all the efforts now of avoiding injury, um, injuries still do happen. So, physical therapists are essential in helping athletes to recover from injuries like sprained ankles, one of the most common injuries, runner's knee or rotator cuff tears in the shoulder. They create customized rehabilitation programs that focus on regaining strength, flexibility, and proper movement. For athletes who undergo surgery, physical therapy is vital, especially post surgical, as these help to restore mobility and function faster. Throughout the recovery, therapists monitor progress closely to ensure athletes return to their sport safely and stronger than before. Moving on to the performance enhancement. So, the goal for this part is physical therapist isn't just about injury recovery, it also helps athletes perform better. Sports physical therapists design training programs tailored to specific demands of each sport, focusing on building strength, power, agility, aiming towards the sport being played. They analyze athletes' movements and to identify inefficiencies and improve techniques, making every motion more effective and powerful. Some therapists use advanced methods like blood flow restriction therapy, which helps athletes build muscle strength even when recovering from injury. All these efforts help athletes reach their peak potential. So let's talk about stretching, one of the most important part. So stretching involves gently lengthening muscles to improve flexibility, reduce muscle tension, and enhance joint range of motion. It is often performed during the cool down phase or after exercise to help relax muscles and prevent stiffness. So it is essential because it keeps the muscle flexible, strong, and healthy, which helps maintain a full range of motion in the joints and reduces the risk of injury such as strains or joint pain. Regular stretching improves blood flow also to muscles, enhances the strength, and supports better posture and balance, making everyday movements easier and helping prevent muscle tightness that can lead to pain or injury. Lastly, cool down. Cool down is typically a light aerobic activity such as walking or slow jogging, followed by static stretches targeting the major muscle groups during the workout. This process gradually lowers the heart rate, aids in the removal of metabolic waste, and promotes recovery while helping to improving flexibility. So cooling down after exercise helps gradually lower heart rate and blood pressure at resting level. It is important after every workout or any activity so that your muscles can go back to its resting resting state. Okay, so in conclusion, sports physical therapists play a key role in injury prevention, acute injury management, rehabilitation, and performance enhancement by developing personalized recovery and training plans that improve mobility, strength, and function. They assess athletes' improvement and movement patterns and risk to reduce injury occurrence. So, there are a lot of techniques in sports rehab that you can not see in a hospital setting. So, it is also a fun field within the physical therapy practice. So that's all.